Welcome back to another video, and thank you so much for being here. In this video, you'll learn about some of the rare psychological disorders you may have never heard about. So let's get started. Number 1. Stendle Syndrome. Those with Stendle Syndrome experience physical and emotional anxiety as well as panic attacks, dissociative experiences, confusion, and hallucinations when exposed to art. These symptoms are usually triggered by art that is perceived as particularly beautiful, or when the individual is exposed to large quantities of art that are concentrated in a single place, such as a museum or gallery, Medscape says. However, individuals may experience similar reactions to beauty in nature. This syndrome is named after a 19th century French author who experienced the symptoms during a trip to Florence in 1817. Stendle Syndrome may also be called hyperculturemia or Florence Syndrome. Number 2. Epidemiophilia. Also known as body integrity identity disorder, epidemiophilia is characterized by the overwhelming desire to amputate healthy parts of the body, according to Medscape. Though not much is known about it, the disorder is believed to be neurological. Those affected may attempt to amputate their own limbs or damage the limbs so that surgical amputation is necessary. Epidemiophilia may be related to right parietal lobe damage in the brain. The condition is challenging to treat because people experiencing it often do not seek treatment. However, both cognitive behavioral therapy and aversion therapies can be attempted in order to treat epidemiophilia once treatment is sought. Number 3. Alien Hand Syndrome. This syndrome is characterized by the belief that one's hand does not belong to oneself, but that it has its own life. Individuals experiencing alien hand syndrome have normal sensation but feel their hand is autonomous with a will of its own. Those with alien hand syndrome may personify the limb as a separate entity. The unaffected hand is under the individual's control, while the affected hand has its own agenda. This syndrome may occur in individuals who have damage to the corpus callosum, which connects the two cerebral hemispheres of the brain. Other causes include stroke and damage to the parietal lobe. The hands then appear to be in intermanual conflict, or ideomotor apraxia, meaning they act in opposition to one another. Number 4. Categorized Syndrome. This syndrome is named for Joseph Capgras, a French psychiatrist who explored the illusion of doubles. Those with Categorized Syndrome hold the delusional belief that someone in their life, usually a spouse, close friend, or family member, has been replaced by an imposter. It can occur in patients with schizophrenia, dementia, epilepsy, and after traumatic brain injury. Treatment approaches mirror those utilized by the underlying disorders and often include antipsychotic medications. Number 5. Alice in Wonderland Syndrome. Also known as Todd Syndrome, Alice in Wonderland Syndrome is a neurologic condition in which a patient's sense of body image, space, and time is distorted. Those experiencing Alice in Wonderland Syndrome may have hallucinations, sensory distortion, and an altered sense of velocity. Alice in Wonderland Syndrome results from change in perception. Though there are many symptoms, the most prevalent one is altered body image. Patients are confused about the size and shape of parts of their bodies. These symptoms can trigger panic and fear responses. Alice in Wonderland Syndrome is often associated with frequent migraines, brain tumors, or drug use. It can affect children between the ages of 5 and 10. Number 6. Mythomania. Mythomania is a condition involving compulsive lying by a person with no obvious motivation. The affected person might believe their lies to be the truth and may have to create elaborate myths to reconcile them with other facts. A pathological liar is someone who often embellishes his or her stories in a way that he or she believes will impress people. It may be that a pathological liar is different from a normal liar in that a pathological liar believes the lie he or she is telling to be true, at least in public, and is playing the role. As with many other mental disorders, it is important to seek counseling if you suspect you or someone you know is suffering. Taboos and stigmas are obstacles one must ignore to achieve mental well-being and treating some of the most bizarre psychological disorders. Number 7. Folie à deux. Folie à deux, from the French for a madness shared by two, is a rare psychiatric syndrome in which a symptom of psychosis is transmitted from one person to another. The same syndrome shared by more than two people may be called folie à trois, folie à quatre, folie en famille, which means family madness, or even folie à plusieurs, which means the madness of many. This disorder usually happens with people living in close proximity to one another, such as husbands and wives. If you are into knowing about some of the most interesting psychological facts, head on over to other great videos. You'll also find a link to them in the description. Be sure to like and comment, subscribe if you want to see more of this awesome stuff, and press the bell icon as well. See you soon!